AMCA Medical Administrative Questions, 130 questions with explained answers. Question 1. The amount of blood pumped by the heart per minute is called: Option A, ejection fraction. Option B, cardiac output. Option C, contractility. Option D, blood pressure. The correct answer is option B, cardiac output. Explanation. Cardiac output is the volume of blood the heart pumps in 1 minute and is commonly described as heart rate multiplied by stroke volume. Question 2. Which of the following statements is true under the doctrine of respondeat superior? Option A. The physician is responsible for any errors made by the medical staff. Option B. The person who has been employed for the longest period of time is responsible for any errors made by the medical staff. Option C. The medical administrative assistant is responsible for any errors made by the medical staff. Option D. The medical administrative assistant is superior to other members of the medical staff. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 3. Another term for outpatient care is: Option A, rehabilitation care. Option B, non-ambulatory care. Option C, ambulatory care. Option D, nursing home care. The correct answer is option C, ambulatory care. Explanation. Ambulatory care means healthcare provided without an overnight hospital admission, so it is another term for outpatient care. Question 4. The primary function of the nervous system is: Option A, to protect deep organs. Option B, to cleanse the blood of pathogens. Option C, to detect changes in the internal and external environment and respond appropriately. Option D, to provide body support and levers for muscle action. The correct answer is option C, to detect changes in the internal and external environment and respond appropriately. Explanation. The nervous system senses changes inside and outside the body, processes that information, and coordinates an appropriate response. Question 5. A patient has an oral temperature of 100.8 degrees Fahrenheit. The medical term for this is: Option A, pyrexia. Option B, pyuria. Option C, hyperpyrexia. Option D, purulent. The correct answer is option A, pyrexia. Explanation. Pyrexia means fever, so an oral temperature above the normal range may be described as pyrexia. Question 6. The tube of choice for glucose testing is: Option A, gray top tube. Option B, red top tube. Option C, light blue top blue. Option D, lavender top tube. The correct answer is option A, gray top tube. Explanation. Gray top tubes contain additives that slow glycolysis, helping preserve glucose concentration in the specimen before laboratory analysis. Question 7. When using a number 10 envelope, where should the address be placed? Option A, 10 lines down from the top and 4 inches from the left edge of the envelope. Option B, 14 lines down from the top and 2 inches from the left edge of the envelope. Option C, 10 lines down from the top and 2 inches from the left edge of the envelope. Option D, 14 lines down from the top and 4 inches from the left edge of the envelope. The correct answer is option C, 10 lines down from the top and 2 inches from the left edge of the envelope. Explanation. The keyed placement centers the delivery address in the standard address area of a number 10 envelope so automated postal equipment can read it properly. Question 8. Which of the following procedures is appropriate for preparing blood and other potentially infectious materials for transport? Option A, freezing the materials before transport. Option B, placing the materials in a leak-proof container during collection. Option C, decontaminating the hazardous waste container. Option D, relabelling containers provided for waste. The correct answer is option B, placing the materials in a leak-proof container during collection. Explanation. Potentially infectious specimens must be placed in leak-resistant containers so blood or body fluid cannot escape during handling and transport. Question 9. The phenylketonuria test is used to diagnose deficiency of phenylalanine hydroxylase, the most common clinically encountered inborn error of metabolism. It is performed on: Option A, blood drawn from a newborn's finger. Option B, a newborn's fecal specimen. Option C, blood drawn from a newborn's buttocks. Option D, blood drawn from a newborn's heel. The correct answer is option D, blood drawn from a newborn's heel. Explanation. Newborn screening for phenylketonuria is commonly performed on capillary blood collected by heel puncture and applied to the designated screening medium. Question 10. Verbal facial expressions or body language, such as a nod of understanding, are called: Option A, external noise. Option B, internal noise. Option C, channels. Option D, feedback. The correct answer is option D, feedback. Explanation. Feedback is the receiver's response that shows whether a message was understood, and it can be verbal or nonverbal, such as a nod. Question 11. Material safety data sheet information includes: Option A, table of chemical elements. Option B, product manufacturing conditions. Option C, general and emergency information. Option D, information on competitor products. The correct answer is option C, general and emergency information. Explanation: a material safety data sheet provides safety information about a chemical, including hazards, safe handling, first aid, and emergency response information. Question 12. A provider withdraws from the care of a patient without reasonable notice of discharge is considered: Option A, abandonment. Option B, malpractice. Option C, negligence. Option D, slander. The correct answer is option A, abandonment. Explanation: abandonment occurs when a provider ends the professional relationship without reasonable notice or without giving the patient a reasonable opportunity to obtain continued care. Question 13. The patient's specimen is lipemic. This is usually an indicator that the patient is: Option A, smoking. Option B, not fasting. Option C, normal. Option D, in basal state. The correct answer is option B, not fasting. Explanation: lipemia makes serum or plasma look cloudy or milky because of excess circulating lipids and can occur when a patient has not fasted before collection. Question 14. What organ's main function is to eliminate excess water and waste products from the body? Option A, liver. Option B, intestines. Option C, gallbladder. Option D, kidneys. The correct answer is option D, kidneys. Explanation: the kidneys filter the blood, remove metabolic waste, regulate water and electrolytes, and excrete excess substances in urine. Question 15. Which of the patient's limbs serves as an electrical ground? Option A, right arm. Option B, left leg. Option C, left arm. Option D, right leg. The correct answer is option D, right leg. Explanation: in a standard electrocardiogram setup, the right leg electrode serves as the reference or ground electrode and is not used to form the main diagnostic limb leads. Question 16. The term refers to the list of charges for each of the provider's services. Option A, fee schedule. Option B, coinsurance. Option C, copayment. Option D, cost sheet. The correct answer is now shown. Explanation: the source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 17. Protected health information stands for: Option A, protected health information. Option B, private health instructions. Option C, private health information. Option D, protected health instructions. The correct answer is option A, protected health information. Explanation: protected health information is individually identifiable health information that is protected by privacy rules when handled by covered healthcare organizations and their business associates. Question 18. Collection devices used in skin punctures are called: Option A, capillary tubes. Option B, butterfly sets. Option C, blood culture collection systems. Option D, 25-gauge needles. The correct answer is option A, capillary tubes. Explanation: capillary tubes are designed to collect small blood samples obtained by skin puncture, such as from a finger or heel. Question 19. A 67-year-old man comes into the doctor's office for a regular checkup. The doctor orders an electrocardiography to be done on the patient. There is junctional escape beat noticed by you. What is the origin of this rhythm? Option A, atrioventricular node. Option B, bundle branches. Option C, ventricle. Option D, sinus node. The correct answer is option A, atrioventricular node. Explanation: a junctional escape beat originates in tissue near the atrioventricular junction when the normal pacemaker fails to fire or its impulse does not reach the ventricles. Question 20. What is the name of the heart valve that separates the right atrium and right ventricle and? Option A, aortic valve. Option B, tricuspid valve. Option C, pulmonic valve. Option D, mitral valve. The correct answer is option B, tricuspid valve. Explanation: the tricuspid valve lies between the right atrium and right ventricle and prevents backward flow into the atrium during ventricular contraction. Question 21. The way to organize appointment scheduling so that it best supports the success of the practice is to: Option A, include a lot of time physician's administrative activities. Option B, allow frequent breaks. Option C, consider the preferences of the physician. Option D, schedule as many patients as possible throughout the entire day. The correct answer is option C, consider the preferences of the physician. Explanation. Considering the physician's working preferences helps create a realistic schedule that supports workflow, patient access, and the way the practice is actually run. Question 22. What is the appropriate test used for heparin therapy? Option A, point-of-care testing. Option B, activated partial thromboplastin time. Option C, hemoglobin and hematocrit. Option D, serum separator tube. The correct answer is option B, activated partial thromboplastin time. Explanation. Activated partial thromboplastin time is commonly used to evaluate the effect of unfractionated heparin on the blood clotting process. Question 23. What does the inside address in a typewritten letter need to include? Option A, the salutation. Option B, the body of the letter. Option C, the name and address of the person sending the letter. Option D, the name and address of the person receiving the letter. The correct answer is option D, the name and address of the person receiving the letter. Explanation. The inside address identifies the recipient of a business letter by giving the recipient's name and mailing address before the salutation. Question 24. A female patient came into the clinic for follow-up after a right-sided mastectomy with some removal of lymphoid tissue. What is the name of the condition that makes blood draw on the right arm not recommended? Option A, syncope. Option B, lymphostasis. Option C, anemia. Option D, hemoconcentration. The correct answer is option B, lymphostasis. Explanation. Lymphostasis means impaired lymph drainage and can occur after lymph node removal, which is why venipuncture is often avoided on the affected side when possible. Question 25. The three kinds of blood cells are: Option A, leukocytes, red blood cells, erythrocytes. Option B, erythrocytes, platelets, thrombocytes. Option C, leukocytes, white blood cells, platelets. Option D, erythrocytes, thrombocytes, leukocytes. The correct answer is option D, erythrocytes, thrombocytes, leukocytes. Explanation. The three major formed elements of blood are erythrocytes, leukocytes, and thrombocytes, which are red blood cells, white blood cells, and platelets. Question 26. Another name for chest leads is: Option A, standard. Option B, precordial. Option C, limb. Option D, augmented. The correct answer is option B, precordial. Explanation. Precordial leads are the chest leads placed across the front of the chest to view electrical activity from different horizontal angles. Question 27. Postprandial means: Option A, before a meal. Option B, before bedtime. Option C, fasting. Option D, after a meal. The correct answer is option D, after a meal. Explanation. Postprandial means after a meal, so a postprandial measurement or instruction is timed after eating. Question 28. Which of the following types of filing systems requires a cross-reference files? Option A, alphabetic. Option B, subject. Option C, geographic. Option D, numeric. The correct answer is option D, numeric. Explanation. Numeric filing systems require an alphabetical cross-reference or index so staff can locate the patient's assigned number from the patient's name. Question 29. The insurance carrier is allowed to use any method to determine the amount for a service, also known as the Option A, fee schedule. Option B, deductible. Option C, allowed amount. Option D, insurance premium. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 30. A physician, specialist or any person that provides medical care is known as the Option A, provider. Option B, policyholder. Option C, subscriber. Option D, dependent. The correct answer is option A, provider. Explanation. A provider is a healthcare professional or organization that supplies medical services to patients. Question 31. The main purpose of personal protective equipment is to: Option A, help project a professional appearance. Option B, protect street clothes from getting soiled. Option C, provide the employee a barrier against infection. Option D, systolic pressure below 90 and diastolic pressure below 60 mm of mercury. The correct answer is option C, provide the employee a barrier against infection. Explanation. Personal protective equipment creates a barrier between the worker and potentially infectious material, reducing exposure to blood, body fluids, droplets, or other hazards. Question 32. The method of scheduling in which one patient is scheduled for a specific appointment time is known as: Option A, single booking. Option B, standard scheduling. Option C, cluster scheduling. Option D, fixed appointment scheduling. The correct answer is option A, single booking. Explanation. Single booking schedules one patient for one specific appointment time, giving each patient an individual time slot. Question 33. A is a set amount that the patient may be required to pay the provider before they can receive benefits. Option A, coinsurance. Option B, deductible. Option C, copayment. Option D, fee schedule. The correct answer is option C, copayment. Explanation. A copayment is a fixed amount the patient pays for a covered service, usually at the time the service is received, according to the insurance plan. Question 34. The acronym used to remember the actions to take when using a fire extinguisher is: Option A, ACT. Option B, HELP. Option C, rescue, alarm, confine, and extinguish or evacuate. Option D, pull the pin, aim at the base, squeeze the handle, and sweep side to side. The correct answer is option D, pull the pin, aim at the base, squeeze the handle, and sweep side to side. Explanation. The fire extinguisher sequence is pull the pin, aim at the base of the fire, squeeze the handle, and sweep side to side so the extinguishing agent is directed effectively. Question 35. Which mode of infection transmission occurs from touching contaminated linens? Option A, droplet contact. Option B, direct contact. Option C, vehicle contact. Option D, indirect contact. The correct answer is option D, indirect contact. Explanation. Contaminated linens act as an intermediate object, so transmission from touching them is classified as indirect contact rather than direct person-to-person contact. Question 36. Managed care organizations control costs by: Option A, limiting patient enrollment. Option B, detecting risk factors early. Option C, discouraging patient visits. Option D, eliminating case managers. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 37. Which of the following is known as swimmer's ear? Option A, otitis externa. Option B, otitis. Option C, otitis media. Option D, otitis interna. The correct answer is option A, otitis externa. Explanation. Otitis externa is inflammation or infection of the external ear canal and is commonly called swimmer's ear. Question 38. When using a ventrogluteal approach to give an intramuscular injection in the buttock area, what is the muscle the medication goes in? Option A, gluteus maximus. Option B, gluteus medius. Option C, right upper and outer quadrant. Option D, gluteus minimus. The correct answer is option B, gluteus medius. Explanation. The ventrogluteal intramuscular site overlays the gluteus medius and is selected because it provides a thick muscle mass away from major nerves and blood vessels. Question 39. An obese patient was sent to the laboratory for a complete blood count. Which of the following veins is MOT likely to be the only that the phlebotomist can palpate? Option A, basilic vein. Option B, cephalic vein. Option C, median cubital vein. Option D, sclerosed vein. The correct answer is option B, cephalic vein. Explanation. The cephalic vein lies along the outer side of the arm and may be easier to palpate in some patients when deeper veins are difficult to locate. Question 40. What is the best sample for the determination of blood pH and blood gases? Option A, cerebrospinal fluid. Option B, arterial blood. Option C, venous blood. Option D, capillary blood. The correct answer is option B, arterial blood. Explanation. Arterial blood is preferred for blood gas testing because it best reflects oxygenation, ventilation, and acid-base status after gas exchange in the lungs. Question 41. Two premature ventricular complexes in a row are called A and N of premature ventricular complexes. Option A, deuce. Option B, couplet. Option C, bigemini. Option D, double. The correct answer is option B, couplet. Explanation. Two premature ventricular complexes occurring consecutively are called a couplet. Question 42. Name this part of the electrocardiogram. Option A, R2R interval. Option B, ST segment. Option C, PR segment. Option D, QRS complex. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 43. One example of a physiologic response to negative stress is: Option A, headache. Option B, high energy. Option C, sleep deprivation. Option D, upset stomach. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 44. How do you know when you have achieved adequate ventilation for a patient when doing cardiopulmonary resuscitation? Option A, air escapes the nose. Option B, air enters the stomach. Option C, rise of the chest. Option D, you hear a popping sound. The correct answer is option C, rise of the chest. Explanation. Visible chest rise shows that enough air is entering the lungs to expand the chest during rescue ventilation. Question 45. A patient came to the clinic for a low-grade fever of 1 month duration. As part of the laboratory workup, the physician ordered erythrocyte sedimentation rate. What color tube would be used for this test? Option A, green top tube. Option B, light blue top tube. Option C, lavender top tube. Option D, red top tube. The correct answer is option C, lavender top tube. Explanation. The source keys a lavender top tube for erythrocyte sedimentation rate testing. Collection requirements can vary by laboratory method, so the laboratory protocol should be followed. Question 46. What is the correct way to calculate pulse pressure? Option A, the number found when subtracting the diastolic from the systolic. Option B, the sum of the diastolic and the systolic. Option C, the pulse taken at the carotid location. Option D, the pulse taken at the apical location. The correct answer is option A, the number found when subtracting the diastolic from the systolic. Explanation. Pulse pressure is calculated by subtracting the diastolic pressure from the systolic pressure, which shows the pressure difference between heart contraction and relaxation. Question 47. Aspirin and acetaminophen are examples of: Option A, analgesics and antipyretics. Option B, antitussives and decongestants. Option C, antihistamines and antiemetics. Option D, antidotes and antibiotics. The correct answer is option A, analgesics and antipyretics. Explanation. Aspirin and acetaminophen reduce pain and can lower fever, which makes them analgesic and antipyretic medications. Question 48. You are to draw the blood of a patient. After reviewing the lab order, you realize that you need to draw a complete blood count with differential on your patient. Knowing that this test is drawn in a lavender top tube, which lab department would this go to for processing? Option A, microbiology. Option B, hematology. Option C, coagulation. Option D, chemistry. The correct answer is option B, hematology. Explanation. A complete blood count with differential evaluates blood cells, so the specimen is processed in hematology rather than chemistry, microbiology, or coagulation. Question 49. After obtaining an electrocardiogram tracing, a medical assistant would be expected to: Option A, check the patient with a pulse oximeter to verify accuracy of the electrocardiogram tracing. Option B, evaluate the patient's medication list for cardiac-altering drugs. Option C, instruct the patient on the tracing results and cardiac prognosis. Option D, observe the tracing for quality and decide if another tracing may be required. The correct answer is option D, observe the tracing for quality and decide if another tracing may be required. Explanation. After recording an electrocardiogram, the medical assistant should check the tracing for artifact and technical quality and repeat it when necessary rather than interpret the diagnosis for the patient. Question 50. Tachycardia is a pathology that damages mainly the: Option A, heart muscle. Option B, brain. Option C, blood vessels. Option D, body organs. The correct answer is option A, heart muscle. Explanation. The source keys heart muscle. Tachycardia means an abnormally fast heart rate and can increase cardiac workload, but the wording that it directly damages one organ should be reviewed for accuracy. Question 51. The smallest structural unit of the nervous system is the: Option A, spinal cord. Option B, neurofibrils. Option C, neuron. Option D, supine. The correct answer is option C, neuron. Explanation. The neuron is the basic structural and functional cell of the nervous system because it receives, processes, and transmits nerve signals. Question 52. Health policies that concern a patient's constitutional right to privacy, informed consent and confidentiality are part of: Option A, medical statutes. Option B, Patient's Bill of Rights. Option C, consent laws. Option D, disclosure laws. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 53. Which of the following is a standard speed for an electrocardiogram machine? Option A, 50 mm per second. Option B, 100 mm per second. Option C, 10 mm per second. Option D, 25 mm per second. The correct answer is option D, 25 mm per second. Explanation. A standard electrocardiogram paper speed is 25 mm per second, which provides the usual time scale for measuring intervals and rates. Question 54. Automaticity refers to: Option A, the ability of the myocardial cell to contract when stimulated by an electrical impulse. Option B, the ability to transmit an electrical stimulus from cell to cell throughout the myocardium. Option C, the ability to respond to an electrical stimulus. Option D, the ability of certain myocardial cells to produce an electrical impulse without the need for outside nerve stimulation. The correct answer is option D, the ability of certain myocardial cells to produce an electrical impulse without the need for outside nerve stimulation. Explanation. Automaticity is the ability of certain cardiac cells to generate electrical impulses spontaneously without an external nerve signal. Question 55. The patient has been given a prescription that says the medication should be taken twice daily. This medication should be taken: Option A, before bedtime. Option B, once a day. Option C, before meals. Option D, twice a day. The correct answer is option D, twice a day. Explanation. Twice daily means the medication is taken 2 times during the day at the intervals directed by the prescriber. Question 56. Sinus is a slow dysrhythmia. Option A, bradycardia. Option B, tachycardia. Option C, rhythm. Option D, dysrhythmia. The correct answer is option A, bradycardia. Explanation. Sinus bradycardia is a sinus rhythm with a slower than expected rate because the sinoatrial node is firing slowly. Question 57. Telephone etiquette involves: Option A, remaining anonymous to avoid any responsibility. Option B, leaving a person on hold until you have the answer. Option C, referring an emotional caller to the administrator. Option D, keeping your statements simple and to the point. The correct answer is option D, keeping your statements simple and to the point. Explanation. Clear, brief statements make telephone communication easier to understand and reduce confusion, especially when giving routine office information. Question 58. A patient's weight should be listed in the patient's chart to the nearest. Option A, pound. Option B, 1/2 pound. Option C, ounce. Option D, 1/4 pound. The correct answer is option D, 1/4 pound. Explanation. The source keys 1/4 pound as the charting precision. This is a documentation convention from the source and should be matched to the policy or equipment standard used in the course. Question 59. To indicate that something lies nearer the surface, use the term: Option A, distal. Option B, deep. Option C, superficial. Option D, proximal. The correct answer is option C, superficial. Explanation. Superficial means closer to or at the body surface, while deep describes a structure farther from the surface. Question 60. The medical assistant is to collect a prothrombin time test, a complete blood count, and a fasting blood sugar. What is the correct order of draw? Option A, gray fasting blood sugar, lavender prothrombin time, red complete blood count. Option B, light blue prothrombin time, lavender complete blood count, gray fasting blood sugar. Option C, lavender fasting blood sugar, red complete blood count, green prothrombin time. Option D, gray fasting blood sugar, lavender complete blood count, light blue prothrombin time. The correct answer is option B, light blue prothrombin time, lavender complete blood count, gray fasting blood sugar. Explanation. The keyed order places the light blue coagulation tube before the lavender hematology tube and the gray glucose tube, which follows the source's order of draw sequence for these specimens. Question 61. A female patient came into the office for her scheduled routine physical. You are measuring the patient's vital signs. Which part of the brain is responsible for the temperature regulation? Option A, hypothalamus. Option B, thalamus. Option C, medulla oblongata. Option D, pons. The correct answer is option A, hypothalamus. Explanation. The hypothalamus helps regulate body temperature by comparing internal temperature signals with the body's set point and triggering heat loss or heat conservation responses. Question 62. When a person stays in the same position all the time, pressure causes the skin to: Option A, become firm and dry. Option B, weaken and become necrotic. Option C, become stronger. Option D, stay pink and moist. The correct answer is option B, weaken and become necrotic. Explanation. Prolonged pressure reduces blood flow to compressed tissue, which can cause tissue injury, breakdown, and eventually necrosis. Question 63. Choose the answer that corresponds with letter B. Option A, brachial artery. Option B, cephalic vein. Option C, ulnar artery. Option D, radial artery. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 64. Mr. Smith is suffering from an enlargement of the bones in the entire skull as well as in the hands and feet, in addition to thickening of the skin. Which of the following conditions is Mr. Smith suffering from? Option A, Addison's. Option B, Cushing's. Option C, acromegaly. Option D, cretinism. The correct answer is option C, acromegaly. Explanation. Acromegaly results from excess growth hormone after the growth plates have closed, producing enlargement of the hands, feet, facial bones, and soft tissues. Question 65. What is the function of the large intestine, also known as colon? Option A, absorb water. Option B, absorb sugar. Option C, absorb fat. Option D, absorb vitamins. The correct answer is option A, absorb water. Explanation. The large intestine absorbs water and electrolytes from intestinal contents and helps form and store feces. Question 66. When analysis of a patient flow is reviewed, what does this help a practice determine? Option A, the day of the week that most patients come in. Option B, the number of times per year a patient visits the medical office. Option C, the amount of time the provider sees patients per week. Option D, the realistic time frame for each appointment. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 67. Which is the most common route of administration of nitroglycerin? Option A, intravenous. Option B, intradermal. Option C, suppository. Option D, sublingual. The correct answer is option D, sublingual. Explanation. Sublingual nitroglycerin is placed under the tongue for rapid absorption, which allows a quick effect when it is prescribed for acute angina symptoms. Question 68. What does this symbol represent? Option A, chemical hazard. Option B, biologic hazard. Option C, radioactive hazard. Option D, Sharp's hazard. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 69. If a finger is excessively milked during a skin puncture, the result will be: Option A, a decrease in pain for the patient. Option B, increased venous blood flow to the puncture site. Option C, an adequate of blood for filling several capillary tubes. Option D, hemolysis and contamination of the specimen with tissue fluids. The correct answer is option D, hemolysis and contamination of the specimen with tissue fluids. Explanation. Excessive squeezing of a puncture site can damage blood cells and mix tissue fluid with the sample, causing hemolysis and dilution or contamination of the specimen. Question 70. The hormone tested for in pregnancy tests is: Option A, thyroid-stimulating hormone. Option B, progesterone. Option C, estrogen. Option D, human chorionic gonadotropin. The correct answer is option D, human chorionic gonadotropin. Explanation. Pregnancy tests detect human chorionic gonadotropin, a hormone produced after implantation and released in increasing amounts early in pregnancy. Question 71. Which of the following precautions require special air handling and ventilation? Option A, contact precautions. Option B, standard precautions. Option C, airborne precautions. Option D, droplet precautions. The correct answer is option C, airborne precautions. Explanation. Airborne precautions require special ventilation because very small infectious particles can remain suspended in the air and travel beyond the immediate patient area. Question 72. You performing a venipuncture procedure on a patient. The needle appears to be inside the vein yet no blood ID flowing into the tube. What should you do? Option A, pull back on the needle. Option B, terminate the procedure. Option C, slightly rotate the needle. Option D, switch the tubes. The correct answer is option D, switch the tubes. Explanation. If the needle appears to be in the vein but no blood enters the tube, a defective tube with lost vacuum is one possible cause, so changing the tube is an appropriate troubleshooting step. Question 73. The amount that an insurance company may say is not allowed and not the responsibility of the patient, for a contracted physician, would be identified as this on the patient's account. Option A, a payment. Option B, an adjustment. Option C, a charge. Option D, a deductible. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 74. What specimens require protection from light? Option A, bilirubin. Option B, lactic acid. Option C, blood gases. Option D, cryofibrinogens. The correct answer is option A, bilirubin. Explanation. Bilirubin breaks down when exposed to light, so specimens for bilirubin testing are protected from light to help preserve an accurate result. Question 75. After a patient interview by the medical assistant, which of the following should not be recorded by the medical assistant? Option A, family medical history. Option B, examination narrative. Option C, chief complaint. Option D, medication allergies. The correct answer is option B, examination narrative. Explanation. The medical assistant may document information obtained during the interview, but the provider's examination narrative belongs to the provider's clinical examination and should not be independently created by the assistant. Question 76. While taking a patient's medical history for active tuberculosis, what type of personal protective equipment is required? Option A, goggles. Option B, lab coat. Option C, gloves. Option D, mask. The correct answer is option D, mask. Explanation. Active tuberculosis is spread through airborne particles, so respiratory protection is required when entering or interviewing a patient with suspected or confirmed infectious tuberculosis. Question 77. Sodium citrate is the additive in what color tube? Option A, red. Option B, green. Option C, light blue. Option D, lavender. The correct answer is option C, light blue. Explanation. Light blue tubes contain sodium citrate, an anticoagulant used primarily for coagulation testing because it binds calcium in a controlled ratio. Question 78. Identify the following rhythm. Option A, atrial fibrillation. Option B, ventricular fibrillation. Option C, junctional tachycardia. Option D, asystole. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 79. A collection tube containing an anticoagulant must be inverted how many times? Option A, tubes containing anticoagulants are not inverted at all. Option B, 10 times. Option C, 8 times. Option D, shake vigorously for 30 seconds. The correct answer is option C, 8 times. Explanation. Anticoagulant tubes are gently inverted several times so blood mixes evenly with the additive and small clots do not form. The source specifies 8 inversions for this item. Question 80. The patient's chart indicates a urine sample was collected at 1800. This means the sample was collected at Option A, 8 inches the morning. Option B, 8 inches the evening. Option C, 6 inches the morning. Option D, 6 inches the evening. The correct answer is option D, 6 inches the evening. Explanation. Military time 1800 corresponds to 6 inches the evening because times after noon are converted by subtracting 12 from the hour number. Question 81. The invoice for the monthly rent of the building where the medical office is located is typically handled by which department? Option A, compliance. Option B, human resources. Option C, accounts payable. Option D, accounts receivable. The correct answer is option C, accounts payable. Explanation. Accounts payable handles money the medical office owes to others, such as rent, utilities, and vendor invoices. Question 82. Family members, such as spouse or children that are covered under the member's insurance policy are known as Option A, members. Option B, beneficiaries. Option C, dependents. Option D, subscribers. The correct answer is option C, dependents. Explanation. Dependents are eligible family members, such as a spouse or children, who receive coverage under the insured person's health plan according to the plan's rules. Question 83. You are the only medical assistant the night shift. You receive orders for all of the following tests within minutes of one another. Which test has the greatest collection priority? Option A, immediate complete blood count in labor and delivery. Option B, immediate electrolytes in the emergency room. Option C, timed blood cultures in intensive care unit. Option D, as soon as possible electrolytes in cardiac care unit. The correct answer is option B, immediate electrolytes in the emergency room. Explanation. An immediate electrolyte order from the emergency room has the highest stated urgency because the result may be needed rapidly for decisions about an acutely ill patient. Question 84. Which of the following tests is not a part of complete blood count? Option A, activated partial thromboplastin time. Option B, differential. Option C, hemoglobin. Option D, hematocrit. The correct answer is option A, activated partial thromboplastin time. Explanation. Activated partial thromboplastin time is a coagulation test, not a component of the complete blood count, which evaluates blood cells and related indices. Question 85. A structure that is composed of two or more tissue types is called an. Option A, system. Option B, organism. Option C, organ. Option D, cell. The correct answer is option C, organ. Explanation. An organ is made of two or more tissue types that work together to perform specific functions. Question 86. The principal advantage of using wave method when designing the scheduling process is that it: Option A, provides more breaks for staff. Option B, allows flexibility to accommodate the unpredictable. Option C, gives priority to established patients. Option D, enables the physician to see more patients each day. The correct answer is option B, allows flexibility to accommodate the unpredictable. Explanation. Wave scheduling builds flexibility into the schedule by grouping several patients near the same time so the office can absorb delays, variable visit lengths, and unexpected events. Question 87. Coinsurance is calculated based on A. Option A, a capitation rate. Option B, percentage of charge. Option C, a fixed charge for each visit. Option D, number of policyholders in the plan. The correct answer is option B, percentage of charge. Explanation. Coinsurance is the portion of an allowed charge that the insured person pays as a percentage after applicable plan rules are met. Question 88. Which of the following requires all employees workplace hazard training? Option A, standard precautions. Option B, bloodborne pathogen. Option C, emergency action plans. Option D, hazard communication standard. The correct answer is option D, hazard communication standard. Explanation. The hazard communication standard requires employers to provide information and training about hazardous chemicals that employees may encounter in the workplace. Question 89. All pathogens are: Option A, microorganisms that live in soil. Option B, microbes that can cause disease. Option C, communicable microorganisms. Option D, normal bacteria found on skin. The correct answer is option B, microbes that can cause disease. Explanation. A pathogen is a microorganism or other infectious agent capable of causing disease in a host. Question 90. When performing a dermal puncture and the lancet hits the bone, what is the potentially serious fatal bone infection that could occur? Option A, osteochondritis. Option B, osteomyelitis. Option C, osteomalacia. Option D, osteoporosis. The correct answer is option B, osteomyelitis. Explanation. Osteomyelitis is an infection of bone. A lancet that penetrates too deeply during a dermal puncture can potentially introduce infection near the bone. Question 91. Defamation through spoken statements is known as: Option A, libel. Option B, sympathy. Option C, empathy. Option D, slander. The correct answer is option D, slander. Explanation. Slander is defamation communicated through spoken words, while libel generally refers to defamation in written or recorded form. Question 92. Veterans with service-related disabilities are eligible for care under which of the following programs? Option A, TRICARE. Option B, VetServe. Option C, Civilian Health and Medical Program of the Department of Veterans Affairs. Option D, CHAMP Aid. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 93. Which of the following drug administration routes is the most appropriate for a patient who has nausea and vomiting? Option A, nasal. Option B, buccal. Option C, sublingual. Option D, rectal. The correct answer is option D, rectal. Explanation. The rectal route can be useful when nausea and vomiting make swallowing or retaining an oral medication difficult. Question 94. Which of the following cannot be handled by the medical assistant? Option A, patient requesting emergency medical advice. Option B, new patient and return appointments. Option C, directions to the facility. Option D, whether or not a physician is in a certain health plan. The correct answer is option A, patient requesting emergency medical advice. Explanation. A request for emergency medical advice requires clinical assessment and decision-making beyond routine administrative handling by a medical assistant and should be escalated according to office protocol. Question 95. Information given by a patient to medical personnel that cannot be disclosed without consent constitutes: Option A, duty of care. Option B, negligence. Option C, judgment. Option D, privileged communication. The correct answer is option D, privileged communication. Explanation. Privileged communication is confidential information shared within a protected professional relationship and is not normally disclosed without authorization or another lawful basis. Question 96. Normal sinus rhythm has a heart rate of beats per minute. Option A, 80 to 120. Option B, 50 to 75. Option C, 60 to 100. Option D, 40 to 60. The correct answer is option C, 60 to 100. Explanation. Normal sinus rhythm is commonly defined as a regular sinus rhythm with a rate from 60 to 100 beats per minute in an adult. Question 97. Which is an example of a recommended preventive procedure? Option A, eating the recommended daily allowances. Option B, teeth whitening. Option C, childhood immunizations. Option D, daily exercise. The correct answer is option C, childhood immunizations. Explanation. Childhood immunizations are preventive because they reduce the risk of developing specific infectious diseases before illness occurs. Question 98. A patient is having a seizure. Which of the following is the most appropriate step for the medical assistant to take to protect the patient? Option A, raise the patient's feet. Option B, call for help. Option C, loosen clothing around the patient's neck. Option D, administer small amounts of liquid. The correct answer is option C, loosen clothing around the patient's neck. Explanation. Loosening tight clothing around the neck can help protect breathing during a seizure. The patient should also be protected from injury and nothing should be placed in the mouth. Question 99. Which of the following is an example of proxemics? Option A, eye contact. Option B, facial expression. Option C, personal contact. Option D, personal hygiene. The correct answer is option B, facial expression. Explanation. The source keys facial expression, but proxemics concerns the use of personal space and physical distance in communication. This item should be reviewed because the supplied key appears inconsistent with standard terminology. Question 100. Which of the following is an example of negative kinesics? Option A, smiling. Option B, eye contact. Option C, frowning. Option D, good grooming. The correct answer is option C, frowning. Explanation. Kinesics refers to body movement and nonverbal expression. Frowning communicates a negative nonverbal message. Question 101. Identify the tubes needed to collect a prothrombin time, immediate electrolytes, and blood culture in the proper order of collection. Option A, yellow, light blue, plasma separator tube. Option B, serum separator tube, yellow, light blue. Option C, light blue, lavender, yellow. Option D, gold, yellow, light blue. The correct answer is option A, yellow, light blue, plasma separator tube. Explanation. The keyed sequence places the blood culture collection first, followed by the light blue coagulation tube and then the plasma separator tube for electrolytes. Question 102. The functional unit of the kidney is the: Option A, nephron. Option B, ureter. Option C, urethra. Option D, bladder. The correct answer is option A, nephron. Explanation. The nephron is the microscopic functional unit of the kidney that filters blood and helps form urine. Question 103. Which of the following is the best specimen to test for levels of iron in the blood? Option A, the one collected in a tube that contains sodium citrate. Option B, the one collected in a microcuvette. Option C, the one collected in the tube that contains ethylenediamine tetrasic acid. Option D, the one collected in a tube with no additive. The correct answer is option C, the one collected in the tube that contains ethylenediamine tetrasic acid. Explanation. The source keys the tube containing ethylenediamine tetrasic acid. Because iron testing methods can depend on the laboratory protocol, this item should be checked against the specific course or laboratory standard being used. Question 104. A phlebotomist enters a room to draw blood on a patient who is hospitalized with an infected wound. The site of the wound and any of its bandages are considered which link in the chain of infection? Option A, portal of exit. Option B, susceptible host. Option C, infectious agent. Option D, mode of transmission. The correct answer is option A, portal of exit. Explanation. An infected wound can release microorganisms into the environment, making the wound and contaminated drainage or dressings a portal of exit in the chain of infection. Question 105. When would a phlebotomist use a multiple sample needle? Option A, along family members who all require the same test. Option B, in a large outpatient laboratory for all patients requiring the same test. Option C, for microcapillary collection. Option D, when more than one tube of blood is to be collected. The correct answer is option D, when more than one tube of blood is to be collected. Explanation. A multiple sample needle allows several evacuated tubes to be filled during one venipuncture without removing the needle from the patient's vein. Question 106. Which of the following would be filled second? Option A, Tommy Turner. Option B, Thomas Turner. Option C, Tom A. Turner. Option D, Tommy Turner. The correct answer is option C, Tom A. Turner. Explanation. The keyed filing order places Tom A. Turner second when the names are alphabetized according to the filing rules used in the source material. Question 107. Notifiable infection must be reported to. Option A, the patient's physician. Option B, your supervisor. Option C, World Health Organization. Option D, Center for Disease Control. The correct answer is option D, Center for Disease Control. Explanation. The source keys the Centers for Disease Control and Prevention. In practice, reporting usually follows state or local public health rules, so this item should be checked against the jurisdiction and course standard being taught. Question 108. Which situation would a medical assistant's signature be required? Option A, after the chief complaint is documented. Option B, after the patient gives a medical history account. Option C, on an informed consent document. Option D, when a patient gives implied consent. The correct answer is option C, on an informed consent document. Explanation. An informed consent document requires signatures to show that the consent process was completed and documented according to office policy and legal requirements. Question 109. Which of the following is an example of a biohazard? Option A, spilling a chemical on a countertop. Option B, splashing of blood when a cap is removed. Option C, touching electrical equipment with wet hands. Option D, the potential for a fire to start. The correct answer is option B, splashing of blood when a cap is removed. Explanation. Blood is potentially infectious biological material, so a splash of blood is a biohazard exposure rather than a chemical, electrical, or fire hazard. Question 110. Faithfulness, or allegiance to a cause, ideal, custom, institution or product, is called. Option A, loyalty. Option B, dependability. Option C, courtesy. Option D, flexibility. The correct answer is option A, loyalty. Explanation. Loyalty means faithfulness or allegiance to a person, organization, cause, or principle. Question 111. A patient has a possible corneal abrasion and needs a referral. Which specialty is a physician that deals with eye injury and disease? Option A, ophthalmologist. Option B, oncologist. Option C, optician. Option D, optometrist. The correct answer is option A, ophthalmologist. Explanation. An ophthalmologist is a physician who diagnoses and treats eye diseases and injuries and can provide medical and surgical eye care. Question 112. No anticoagulants are found in which of the following tubes? Option A, green-topped. Option B, yellow-topped. Option C, lavender-topped. Option D, red-topped. The correct answer is option D, red-topped. Explanation. A plain red-topped tube traditionally contains no anticoagulant, allowing the blood to clot so serum can be separated after centrifugation. Question 113. In a standard 12-lead electrocardiogram, the measurement of current that the heart muscle produces between the right arm electrode and left arm electrode is known as the Option A, standard limb lead 3. Option B, augmented lead. Option C, standard limb lead 2. Option D, standard limb lead 1. The correct answer is option D, standard limb lead 1. Explanation. Standard limb lead 1 records the electrical potential difference between the right arm and left arm electrodes. Question 114. Choose the answer that corresponds with letter F. Option A, basilic vein. Option B, medican-cubital vein. Option C, radial artery. Option D, cephalic vein. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 115. The boundaries for the approved area in performing heel punctures are: Option A, the line extending from the third toe, dividing the plantar surface into medial and lateral aspects. Option B, the line extending from the third and fourth toe, dividing the plantar surface. Option C, the lateral line extending from the third toe and the medial line extending from the second toe. Option D, the medial line extending from the great toe and lateral line extending from the fourth and fifth digit. The correct answer is option D, the medial line extending from the great toe and lateral line extending from the fourth and fifth digit. Explanation: heel punctures are limited to the approved medial and lateral plantar areas to reduce the chance of injuring the heel bone, nerves, and vessels. Question 116. When a blood pressure cuff is deflated, the first tapping sound is the pressure. Option A, pulse. Option B, systolic. Option C, mean arterial. Option D, diastolic. The correct answer is option B, systolic. Explanation: the first Kurokov sound heard while the cuff pressure falls marks the systolic pressure, which reflects arterial pressure during ventricular contraction. Question 117. Cellular respiration is a function of the option A, cell membrane. Option B, mitochondria. Option C, Golgi apparatus. Option D, nucleus. The correct answer is option B, mitochondria. Explanation: mitochondria generate most cellular energy through aerobic cellular respiration, which is why they are often called the energy-producing structures of the cell. Question 118. Your patient is experiencing chest pain and has a heart rate of 132 beats per minute. You attach the electrocardiogram monitor and see a fast, regular rhythm with a round upright P wave that precedes each QRS complex. The QRS complexes are 0.1 seconds in duration. This patient is experiencing option A, junctional escape rhythm. Option B, sinus tachycardia. Option C, complete atrioventricular heart block. Option D, idioventricular rhythm. The correct answer is option B, sinus tachycardia. Explanation: a fast regular rhythm with a normal upright P wave before every narrow QRS complex is characteristic of sinus tachycardia because the rhythm is still originating from the sinus node. Question 119. The act of listening for sounds made by internal organs to aid in the diagnosis of certain disorders is called option A, menstruation. Option B, percussion. Option C, auscultation. Option D, palpation. The correct answer is option C, auscultation. Explanation: auscultation means listening to internal body sounds, usually with a stethoscope, such as heart, lung, and bowel sounds. Question 120. Issues relating to medical advances come under the heading of option A, malfeasance. Option B, religious freedom. Option C, bioethics. Option D, ethics. The correct answer is option C, bioethics. Explanation: bioethics applies ethical principles to questions created by medicine, biology, healthcare technology, research, and advances in treatment. Question 121. Mr. Matthews called the office to get the test results for his wife, Martha. What should the medical assistant do? Option A, tell Mr. Matthews that you cannot release the information. Option B, check the medical record to see if Mr. Matthews is really Martha's husband, if so then release the information. Option C, tell Mr. Matthews the test results. Option D, check the medical record to see if Mr. Matthews is authorized to have this information on Mrs. Matthews' Health Insurance Portability and Accountability Act form. If so, then release the information. The correct answer is option D, check the medical record to see if Mr. Matthews is authorized to have this information on Mrs. Matthews' Health Insurance Portability and Accountability Act form. If so, then release the information. Explanation: test results may be released to a spouse only when the patient has authorized that disclosure or another valid legal basis exists, so the medical record must be checked before information is shared. Question 122. To determine our ventricular pulse, the electrocardiogram technician would: option A, calculate the ST repolarization segments. Option B, calculate the spacing between the P waves. Option C, calculate the spacing between the ventricular repolarization T waves. Option D, calculate the spacing between the QRS complexes. The correct answer is option D, calculate the spacing between the QRS complexes. Explanation: ventricular rate is determined from the spacing of the QRS complexes because each QRS complex represents ventricular depolarization and normally corresponds to one ventricular beat. Question 123. What drug enhances the effects of another drug? Option A, narcotic. Option B, antagonist. Option C, trade. Option D, synergistic. The correct answer is option D, synergistic. Explanation: a synergistic drug interaction occurs when one drug increases or enhances the effect of another drug. Question 124. The mental and emotional condition, enthusiasm, loyalty, or confidence of an individual or group with regard to function or tasks at hand is called Option A, morale. Option B, insubordination. Option C, initiative. Option D, tenacity. The correct answer is Option A, morale. Explanation. Morale describes the confidence, enthusiasm, and emotional outlook of an individual or group toward its work and responsibilities. Question 125. A quantitative test is one that: Option A, tests for the presence and amount of substance in sample. Option B, tests for presence of substance only. Option C, does not require a trained technician. Option D, tests for all substances found in the sample. The correct answer is Option A, tests for the presence and amount of substance in sample. Explanation. A quantitative test reports how much of a substance is present, while a qualitative test generally reports whether the substance is present or absent. Question 126. Also known as problem-oriented medical record, is a method of tracking the patient's problems during the time they are receiving medical care. Option A, problem-oriented model records. Option B, problems on medical records. Option C, problem-oriented medical record charting. Option D, prognosis on medical record charting. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 127. A round, raised skin lesion with itching that is a positive sign of reaction to allergic testing is A. Option A, wheal. Option B, nodule. Option C, papule. Option D, vesicle. The correct answer is Option C, papule. Explanation. The source key's papule, but allergy skin testing is commonly described as positive when a wheal develops. This item should be reviewed because the supplied key and standard terminology may not agree. Question 128. The term used to describe sophisticated and highly complex care is: Option A, managed care. Option B, tertiary care. Option C, secondary care. Option D, primary care. The correct answer is Option B, tertiary care. Explanation. Tertiary care is highly specialized, complex care that often involves advanced technology and subspecialty expertise. Question 129. Samples appear to have been mislabeled and mixed on 2 patients. Each outpatient has orders for both blood and urine test, so there were 2 samples for each. What would be the best course of action? Option A, recollect all 4 specimens from the patients. Option B, relabel the urine samples, but redraw the blood. Option C, have the patients come back and identify their specimens. Option D, relabel all the specimens. The correct answer is Option A, recollect all 4 specimens from the patients. Explanation. When patient specimens may be mislabeled, the safest action is to reject the questionable specimens and recollect them using correct identification procedures rather than guess which sample belongs to whom. Question 130. Most exposures to human immunodeficiency virus in healthcare settings are the result of: Option A, contact with acquired immunodeficiency syndrome patients. Option B, splashes during surgery. Option C, accidental needle sticks. Option D, tainted blood transfusions. The correct answer is Option C, accidental needle sticks. Explanation. Needle stick injuries are a major occupational route of exposure to blood-borne pathogens because contaminated sharps can introduce infected blood directly through the skin.